I'm Dr. Chichi. Welcome to Everyday Health MD. Today, I want to talk about something I see all the time, which is patients getting lab results, see an abnormal number, and immediately get worried. Some people even become so anxious and freak out. The truth is, one lab result, one number being abnormal, doesn't tell us the whole story. Now, let me tell you why. You see, most people get their labs before speaking to their doctors. And then when you see things like words like high, low, abnormal, it's natural to become worried. But I want you to know that labs by themselves are not a diagnosis. They are only used as tools. A single number without a context can be misleading. Lab numbers are a snapshot. It only tells us what's going on at a particular point in time. There are several things that can affect lab numbers. I'll give you examples. Sleepless nights, stress, hydration status, even the time of the day that the lab is being drawn can affect it. So when you have one abnormal number, it doesn't automatically mean something is wrong. In medicine, we care more about trends than a particular value. We look at the numbers. Are these numbers changing? Are they improving? Are they worsening? Are they stable? We also use your lab results, try to interpret it with the patient's symptoms, physical examinations. So when you have an abnormal number, it doesn't automatically mean that something is wrong. Labs should always be interpreted with the patient's symptoms, the patient's medical history, the patient's physical examination. Somebody can come in with his labs looking all normal, but then you see the patient, the symptoms clearly warrant immediate medical attention. And you find another person who comes in with a lab with numbers looking horrifying, but when examining the patient or even speaking to the patient, everything looks fine. That is why context matters. One lab result cannot tell us the full story. So, from a preventive medicine standpoint, your labs are not meant to cause fear. It only helps us to identify patterns. They also help us to guide conversations, lifestyle changes, sometimes even to ask for further testing so that we can understand your clinical condition better. They are not meant to cause fear. Preventive medicine is all about awareness, not anxiety. If I'd like for you to remember one thing from this video, it will be that one lab result doesn't tell the full story. Trends, context, the full clinical picture matters. If you found this helpful, subscribe to Everyday Health MD for clear, practical explanation of labs, symptoms, and preventive care. Thank you for being here.